I will begin with the examination of a newborn. So there are some prerequisites for the examination of newborn, which includes number one, hand hygiene. Before that, before hand hygiene, we have to maintain the room temperature of the delivery room where the newborn is has to be cared. So temperature should be maintained at thermoneutral temperature. That means there is a definition of thermoneutral temperature. It says that it is the temperature required to maintain the minimal basal metabolic rate of a baby, so that the baby can maintain his normal body temperature, which means there might be slight change in the room temperature of a delivery room. For different babies, preterm baby may require some different temperature and term baby may require some different temperature. So temperature should be maintained in such a way that baby has minimal basal metabolic rate, so that baby can maintain his normal body temperature of 36.5 to 37.5 degree of temperature. That is the meaning of thermoneutral temperature. So after maintaining the temperature of the delivery room, we have to be careful about the hand hygiene, and there are
सर ये सर ने ये कुछ टेम्परेचर बताया था, जैसे लेबर रूम का 20 डिग्री बताया था,
वो डिफरेंट,
और फिर ये पोस्ट नेटल का 28 डिग्री, एनआईसीयू का 30 डिग्री बताया था,
26 डिग्री,
और बच्चे का कोर टेम्परेचर 36.5 to 37.5. फिर उसके बाद हैंड वॉशिंग
there are 6 steps of hand washing according to WHO guideline. त्यो WHO guideline त होइन,
ए सर ने हमें यही बताया.
ठीक है. अब फर्स्ट we have to fold our legs, fold our
arm
close up to the elbow.
हाँ, जो भी स्लीव्स है ऊपर तक एल्बो तक ले लेना है ना.
Our entire forearm is exposed. Then after we have to step one is we have to apply the soap and rub the palm.
हाँ. palm कैसे रब करना है सर? ऐसे रब कर. Okay.
We have to rub the palm.
Okay.
Then after step two is
interdigitation.
We will rub our right over the left like this. And
अच्छा, ये सब वेब स्पेसेस, सारी वेब स्पेसेस कवर होनी चाहिए ना.
Then left we will rub the right left. And then after step three is so this area is spared. So we will rub this area like this.
Okay.
यस्तो.
कैसे है मानो? नहीं मुँह. हाँ ये सही कर रही, दिखाओ एक बार. हाँ ये दूसरा हाथ भी. हाँ ये ऐसे. ठीक है. लो.
Third step.
हाँ ठीक है.
And then
fourth step
is we have to while doing this part is spread. Fourth step we will rub our thumb finger with both hands alternately. This one is the fourth step. And the fifth step is we have to clear our nails of the nails. So
हाँ ऐसे करना है ना. हाँ very good.
And the sixth one is we have to rub our wrist up to the elbow, and then we'll wash our hands with clean water, and then we'll keep our hand in this position.
Then we'll go to the
hand washing. And then
level अच्छा, there should be good light source also.
Good light source for the examination. And another one was
then alertness
staging. So while beginning with the newborn examination, we cannot examine the newborn immediately after the feeding also. So while manipulating the baby, there might be aspiration. So ideal time for examination is 1 hour or 2 hours after the feeding of the newborn. And another is there are staging system so of the consciousness of the baby. And in के थियो उसको थियो.
अच्छा, स्टेजिंग क्या ये?
इसका नाम के थियो?
स्टेजिंग का क्या नाम थियो?
बालजादार हो कि के थियो हैन? बालजार के थियो हैन? त्यो स्टेजिङ अनुसार चाहिँ स्टेज we examine the newborn baby in stage 3 and 4. We do not examine the baby in there are five stages. We examine the baby in the 3 and 4, in which the baby is either in no movement, awake but no movement, or awake and some movement.
ये सर यहाँ से देख के एक बार पढ़ लेते हैं. स्टेज 1 में सर ने बोला था baby is in deep sleep. That means that time reflexes are diminished, like Moro's reflex, everything will be diminished. So will not do in stage 1. In stage 2 there is a REM sleep, that is rapid eye movement sleep. But in that time problem is that there is heart rate is irregular, respiratory rate is irregular. So we can't do in stage 2 also. Stage 3 and stage 4 are preferred for the examination, in which there is child is awake but there is no limb movement. In stage 4 child is awake, some limb movement. And stage 5, baby is crying, the respiratory rate will differ, so we don't do here also. So stage 3 and stage 4 is good for neonatal examination. Okay, त्यसपछि part 2 में we go for neonatal examination proper. In that we see gestational age, head to toe examination, systemic examination. In this video we'll go up to gestational age completion, that we do by Ballard score. Okay, Ballard score, in Ballard score we see physical appearance and neuromuscular examination, no?
Physical maturity
and physical maturity and neuromuscular we see. Earlier there was Ballard score, but now it has been updated, so now we called old Ballard score and new Ballard score. In old Ballard score we used to do examination for the 28 week to 40 weeks children, no, babies. And in new Ballard score we are considering the from 22 weeks to 44 weeks.
Okay, this new expanded new Ballard score can give the gestational age from 20 weeks to 44 weeks. 20 weeks to 44 weeks, but we are considering 22 weeks as per the WHO guideline, and 22 to 44 weeks are that criteria for the perinatal period. So we are considering this. But expanded Ballard score can tell up to 20 to 44 weeks.
Okay, sir. Now let's discuss about the Ballard score that contain physical maturity and neuromuscular. So we are going to discuss about neuromuscular.
We'll begin with the physical maturity.
Okay, physical maturity.
So we will just only talk about the headings and what we will look for. The scoring we will do according to the chart. We don't have to remember that chart by heart. We will look at the chart and score ourselves, but we'll look for what we have to look in the physical maturity. So we'll begin with the skin. So we'll examine for the skin. If the skin is, we'll look for the texture of the skin and what color is of the skin underlying. Are there any underlying visibility, transparent, translucency? We'll see for that and we'll score according to the chart. And after looking for the skin, we'll go for the laryngoscope. To look for the laryngoscope, we'll see the back of the baby in the shoulder blade area, and according to the distribution and that sparseness of laryngoscope, we'll again score. After laryngoscope, we'll
laryngoscope, I would like to just add that laryngoscope is present in preterm babies. Preterm babies. Okay, sir. Next,
we'll go for go from above to down. So we'll look for the ear recoil, development of the cartilage. We'll examine in the ear and we'll see for the ear recoil, and accordingly we'll score.
Okay.
And then
in preterm ear recoil is slow. And in term ear recoil is normal.
And then we go from above down and we'll look for the breast bud. We have to measure the breast bud. So we can also feel the are there in palpable breast bud or not, and more than 5 millimeter. 5 millimeter is term and less than 5 millimeter is preterm. And then we'll go down to look for the external genitalia, and in according to that, in female in term the labia majora will cover the minora, and clitoris is not that prominent in term, but in preterm majora does not cover the minora and clitoris is prominent. In case of male, according to the descent of testis also, we can see for are there testis present in the scrotum or not.
And 9 months tested descent.
So we'll score accordingly and then complete our this external genitalia, and then we go for palmar crease. We'll see for palmar crease, and if there is covering of up to 1/3, 2/3, and we will also score accordingly.
Sir, covering of palmar crease.
Palmar crease चाहिँ अब यो कहाँसम्म यो क्रिज चाहिँ कति छ कि लेन्थ चाहिँ यो ड्युरेसन प्लान्टरकोलाई चाहिँ कति कभर गरेछ, त्यो अनुसारको स्कोरिङ छ मलाई।
ए पोस्टीरियर टू एंटीरियर,
पोस्टीरियर कभर्स न के रे एंटीरियर
कितना कवर करना चाहिए सर, एक बार देख के बताओ ना बुक में।
प्लान्टर सर्फेस चाहिँ हिल टु टो लेन्थ अब माइनस भनेको 40 to 50 mm भनेको -1 भयो हैन।
नॉर्मली क्रीज कवर ओवर दी सोल। अच्छा, नॉर्मली यहाँ से लेके यहाँ तक कवर करता है। अगर जितना कम है उतना मैच्योरिटी कम है, और
इंटीरियर टु थर्ड मात्रै कभर भयो भने अझै कम भयो हैन। अनि ट्रान्सफर्स क्रिज मात्र आछ कि हैन, अनि फेन ट्रेडमार्क्स मात्र छ, क्रिजै छैन अनि क्रिज चाहिँ म्याच्योरिटीको साइन भयो हैन। क्रिज भयो भने म्याच्योरिटी भयो, जति धेरै क्रिज त्यति धेरै स्कोर भयो। अनि त्यसपछि यो दिस कम्प्लिट्स आवर फिजिकल म्याच्योरिटी।
जस्ट 1 सेकेन्ड सर, आई जस्ट Exinaceri samathan. Okay, I just keep it here so that we can study that time, no? त्यसपछि
Then we'll begin with
just a second, sir. Just a second. Okay, sir. Now let's go
then,
to.
Let's begin with the neuromuscular maturity. So we'll begin with the posture of a child. While baby is in supine position, we'll look for the position, that attitude of the baby. And in term baby, the attitude is of flexion. So the baby tends to flex their hands and legs. So their position is of flexion attitude. But in preterm, the position is of extended position. That is the posture. And then after we'll begin with the examination in the hand, and we'll go simultaneously. Later we'll go to the leg. So in the hand we'll look for the square window sign. For this we'll bend the hand of a baby.
Sir, मेरे हाथ में करके दिखाइए. Suppose करो baby is hand.
We'll bend the hand of a baby on the anterior aspect of the forearm, and we'll see for the how much angle it makes. If fully flexed and the angle is of 0, then we'll call it.
मतलब मेरा palm और ये forearm touch कर गया तो angle 0 है.
सीधा ये ऐसा नहीं कि ये भी सीधा है और ये भी सीधा है. सब. We'll score it as more score will be of that 0.
अगर preterm होगा तो ये touch नहीं करेगा, और term होगा तो ये touch करेगा, because term babies are more flexible, no? Flex होता है उनका सब कुछ ज्यादा.
त्यसपछि चाहिँ अब त्यो गरिसकेपछि स्क्वायर विन्डो ह्यान्डमा स्क्वायर विन्डो भयो हैन. त्यसपछि विल सी फर आर्म रिकॉइल विल baby tends to be in flexion position. So the baby will be in the flex position like this, and we will extend their arms and we will release it. And we will see whether it goes is how much degree it makes with the arm and the forearm after we release it.
ये भी चेक करना है कि सर ऐसे ही हाथ नीचे लाके ऐसे छोड़ देना है, ऊपर जा रहा है तो मतलब आर्म रिकॉइल ठीक है.
आर्म रिकॉइल ऊपर जा रहा है और कितना ऊपर जा रहा है.
ओके
कितना ऊपर तक जा रहा है.
नॉर्मली ऐसे यहाँ तक जाता है ना बेबीज का. ओके
जितना ऊपर गए उतना इसको ज्यादा है.
ओके.
देन वी विल सी फॉर scarf sign. To look for scarf sign, we'll bend the one arm over the chest, and we'll see for the in such a position that this hand tip of the finger is touching the opposite shoulder. So and we'll see for the elbow.
Normally
either elbow crosses the midline or does not cross the midline, or what we'll see.
अच्छा, if crosses the midline, it is preterm. If it is term, it will not cross the midline.
नगर्ने पनि अब यता कहाँसम्मको छ त्यो अनुसारको स्कोरिङ हुन्छ. अब यो जति प्रिटर्म यति यता आउँछ, जति टर्म उता आउँदैन के यता. यो चाहिँ उ भयो.
आर्म रिकॉइल में
सिर्फ
हैंड एंड फोरहैंड का एंगल मेजर कर रहे हैं.
यो यस्तो गरेर नि
आर्म रिकॉइल भयो, स्क्वायर विन्डो साइन भयो, स्कार्फ साइन भयो, त्यसपछि
अब
तल
खुट्टाको हैन, खुट्टाको चाहिँ अब विल सी फर पोप्लिटेल एंगल. टु दिस विल flex the lower limb at the hip joint. While in the flexion of the thigh, then we'll hold the that patella of a baby with another hand and stabilize the hip, and then we'll do the extension of the knee, and we'll see for the popliteal angle.
मतलब ये एंगल हम चेक करेंगे कि कितना है. अगर प्रीटर्म बेबी होगा तो ये
एंगल बहुत ज्यादा होगा,
एंगल बहुत कम होगा. सॉरी,
ये
जैसे प्रीटर्म होगा तो पूरा एक्सटेंड हो जाएगा तो एंगल ज्यादा हो जाएगा. टर्म होगा तो ये एंगल कम होगा. नहीं,
यो भएपछि के भयो,
ये पॉप्लिटियल एंगल है.
यो आफ्टर फिनिशिङ दिस we'll look for the heel to ear test.
Heel to ear. Okay.
How much it will go and touch the ear or not. If it fully goes up above the above and touches the ear, it is the preterm. And त्यसपछि चाहिँ अब जति यो फ्लेक्सन यु भयो
यो दुईटै एकैचोटी गर्ने हो.
दुईटै खुट्टालाई.
अच्छा, एक बात बताओ सर, जब ये और ईयर टच हो रहा है इसका मतलब प्रीटर्म है कि टर्म है? प्रीटर्म है. ओके. नॉर्मली अगर बच्चा टर्म है तो ये पूरा टच नहीं करेगा. टच नहीं करेगा, थोड़ा पहले, क्योंकि ये पार्ट तो फ्लेक्स रहेगा ना. ये पार्ट फ्लेक्स रहेगा तो वहाँ तक तो जाएगा ही नहीं ना. प्रीटर्म का ये एक्सटेंडेड होता है पूरा, इसलिए वहाँ पे जाके टच कर जाता है. नहीं भैया. Okay, rest will continue in next video.